So another thing that people don't talk about a lot with Lyme disease is the fact that Lyme disease can be transmitted to unborn babies. And we know this because we have seen women who have had a stillbirth and the entire placenta is full of spirochetes. And that was the very first study that made us understand that this could happen. Now, initially we always thought that this would only occur if the mom was infected while she was pregnant. Well, I'm going to tell you that that's not the case. If the mom was infected at any time in their life and was never treated, and the infection is still active, there is no doubt in my mind that that mom could transmit that infection to that unborn baby, especially with an active infection. With a non-active infection, probably not, but an active infection, yes, it could happen, and we have seen it happen. And in the world of children with Lyme disease, we're seeing more and more of these kids being diagnosed with Lyme disease in cases of kids who have autism, who have ADD, who have learning disabilities, who have pans pandis, which is a chronic strep infection. Oftentimes we will see them also infected with Lyme disease. So we have a very large young population of people that are growing up unhealthy, and we've got a lot of labels for them, and I'm not saying there's anything wrong with labels, but I come from the nature of, let's not just label someone, let's find out why they're exhibiting these symptoms. And then if we find out the why, we can apply treatment that can fix the why, and then maybe they won't have those symptoms that they're expressing that we're just going to medicate for no reason. You know, truly, if we need medication, that's great and we can use it. But from a naturopathic standpoint, we always want to identify the why. And so with kids that maybe have been infected through their moms during pregnancy, we want to explore those options most definitely. With moms who are pregnant, we want to make sure that this is not a problem. And one of the ways that we question whether or not Lyme disease is a problem is by looking at factors that cause pregnancy loss. And so I used to work in fertility many, many years ago, and during that time there was a large population of people in our practice that suffered recurrent pregnancy loss. And for some of those women, we were able to identify certain conditions, genetic issues or clotting issues that caused their recurrent pregnancy loss. And for some women, as simple as a thyroid disorder that was not diagnosed. But in many cases, we were never able to find the reason for the recurrent pregnancy losses. You know, one pregnancy loss is hard enough on a woman. 5, 10, 15, even 20 pregnancy losses is devastating to that woman. And so if we can help them identify the possibility of Lyme disease or tick-borne disease of a co-infection of some kind being the cause for their recurrent pregnancy loss, and we can help them sustain a pregnancy to term, oh my gosh, you know how exciting that is and how wonderful that is to be able to create a life that's healthy and happy and bring this mom a gift that they have been trying to obtain for years. I cannot tell you how awesome that feeling is. And over the last 10 years, our practice has helped about 5 or 6 women who have suffered from recurrent pregnancy loss actually obtain a pregnancy to term. Now, some of these women did some research on their own, and they found that Lyme disease could be a problem and came in knowing exactly what they were looking for and tested them, and lo and behold, yes, they did have Lyme and or other tick-borne illnesses. And once we treated them and got them healthy and treated them during pregnancy, they were able to sustain a pregnancy. And I have one case, not only did she sustain one pregnancy, she carried 2 pregnancies to term. And she had not been able to do that before at all. And they are both healthy, happy children, still testing negative for Lyme disease 5 years later, and they are having an awesome life. And I've had other women who've come in And they had no clue that Lyme disease could be a possibility. And they had no recollection of a tick bite. And we start looking at co-infections and Lyme disease, and lo and behold, we find an infectious process that's causing their pregnancy loss issue, or that we suspected. And once we started treating it, and they were able to get pregnant, and they were able to sustain that pregnancy to term, they were so thrilled that we were able to identify the problem, fix the problem, and resolve the whole issue that was going on. And you know, in naturopathic medicine, that's what's great, is we want to find the cause and then deal with the cause so that you can totally, or 80% of the time, eradicate the problem and not just put a Band-Aid on the symptom itself. So these are some things that we don't talk about in the general community about Lyme disease. And I think every woman should be thinking about this, and guys too. We don't know that a guy's sperm maybe is infected with Lyme disease, and when that sperm impregnates a woman, does that cause the transmission to the baby? We don't know. But you know what? When we're talking about wanting to start a family, we want to start off on the best foot. We want to give them everything that we could possibly give them that will make them healthy and happy. And so that's what we're looking at doing with you. And if you have Lyme disease and you've suffered recurrent pregnancy loss, or you know someone who's been trying to get pregnant and really struggling and not being able to do that, please encourage them to look at tick-borne disease as a possibility, especially if they're in a high-risk state, or they've been camping, they live near the woods. And even if they don't, if you're in the city, explore it. You never know if this could be a problem until you look. So you guys have a great day with those tips. I hope they're helpful for you. Look us up online if you need anything, and please, if you think somebody could benefit from this video, please share it. Have a great day, guys.